The doctors told them it was a special treatment, a needle pushed deep into the spine. They were promised it would cure their bad blood. It didn't cure anything. This was the Tuskegee Syphilis Study. The story begins in 1932, Macon County, Alabama, a quiet rural region where most families survived on sharecropping. Work was hard, money was scarce, medical care was almost non-existent. So when government doctors arrived offering free treatment, many men lined up. The program was organized by the U.S. Public Health Service in cooperation with the Tuskegee Institute. 600 black men agreed to participate. 399 of them already had syphilis, but none of the men were told that. Instead, doctors used a vague local phrase. They told them they were being treated for bad blood. Bad blood could mean almost anything in the rural South. Fatigue, anemia, infection, or syphilis. The men were promised free medical care. They were offered hot meals during clinic visits, and they were promised something deeply important in communities where poverty was constant: burial insurance. If they stayed in the study, their families would be guaranteed help paying for a proper funeral. For many of the men, that mattered more than anything. Even in death, they wanted dignity for their families. So they kept coming back, year after year. But the doctors already knew something the men did not. The study was never meant to cure them. The real purpose was to observe what happened when syphilis was left untreated. Blindness, paralysis, mental deterioration, death. And so the men continued showing up to appointments, believing they were patients, when in reality, they were subjects. At certain points, doctors told participants they were eligible for special free treatment. The men received letters urging them to come to the clinic. Last chance for special treatment, the letters said. But the treatment wasn't treatment at all. It was a spinal tap, a long needle inserted into the lower spine to extract fluid. The procedure was painful, and it didn't cure anything. It simply allowed researchers to measure how far the infection had spread into the nervous system. Many of the men believed the spinal tap was the cure they had been promised. Instead, it was another way to watch the disease progress. The men were promised burial insurance if they stayed in the program. Many believed it meant their families would be able to afford a proper funeral. But for the researchers, it also made it easier to perform autopsies when the men died, because the final stage of the experiment came after death. The burial benefit wasn't just an act of kindness. It helped guarantee the researchers could collect the final stage of data they wanted. Then something happened that should have ended the study immediately. During World War II, scientists discovered that penicillin could cure syphilis. By the mid-1940s, the treatment was widely available. For most patients, a few doses of penicillin could stop the disease entirely. But the Tuskegee study did not stop. Instead, they chose to continue the experiment. The researchers didn't just fail to treat the men. They actively prevented them from receiving treatment elsewhere. Doctors contacted local medical providers and asked them not to treat the participants. And when some of the men were drafted into the military during World War II, the researchers intervened with draft boards to make sure they would not receive penicillin during Army medical exams. The cure existed. The doctors had access to it, and they made sure their patients never received it. Over the next decades, the damage spread quietly through families. Men began losing their eyesight. Some developed severe neurological damage. Others died from complications of the disease. Many of their wives were unknowingly infected. Children were born with congenital syphilis, carrying the disease from birth. And still, the men kept returning to the clinic because they believed the doctors were helping them. In the surviving photographs from the study, the men sit outside the clinic, waiting for their appointments, hats in their hands, jackets folded neatly across their laps. They looked like patients waiting to see a doctor. But by then, the doctors had already decided they would never receive the cure. The Tuskegee study did not last a few years. It lasted 40. From 1932 to 1972, meaning it continued through World War II, the Civil Rights Movement, and even the moon landing. While rockets carried humans into space, doctors in Alabama were still quietly observing men they had chosen to watch die. By then, the experiment was no longer about discovering what syphilis did to the body. The doctors already knew. Now, they were simply watching it happen. The experiment might have continued even longer, but in 1972, a whistleblower exposed the study. Peter Buxton took what he knew to the press. When Americans learned what had happened, the reaction was immediate. Within months, the government shut the experiment down. After 40 years, the study finally ended. But for many families, the damage had already been done. By the time the study ended, dozens of the men had already died from syphilis. Many more suffered permanent health damage. Their families had lived with the consequences for decades, and most of the men never knew the full truth of what had been done to them. In 1997, 25 years after the study ended, the US government issued a formal apology. President Bill Clinton addressed the surviving participants and their families. He called the experiment what it was, a profound betrayal. But apologies cannot erase 40 years. The legacy of the Tuskegee Syphilis Study still echoes today. For many people, it permanently shattered trust in the medical system. Because the men of Macon County had believed they were receiving care, they trusted the doctors. They trusted the government. And for 4 decades, that trust was used against them. The men were promised treatment. They were promised dignity. Instead, the doctors simply watched and called it research.